Hi, this is Dr. Toll with Tier 1 Education. Very often we'll see patients who have a diagnosis of lumbar radiculopathy, and although we're very thorough to rule out the spine, we do want to keep in mind there's that potential for a gluteal trigger point to mimic signs of a radiculopathy. So it's very important that we rule out any kind of dural tension as well as the lumbar spine, but probably also do a detailed palpation to the lateral glutes to see if there's a referral. These referral patterns are very often individualized, and although we know there aren't consistent referral patterns, very often you'll see a glute medius and glute minimus referral pattern go down the lateral side of the thigh into the lateral side of the calf. So we'll go over how to palpate for those trigger points and see if it reproduces familiar symptoms. So in assessing for a gluteal trigger point referral pattern that could be mimicking a lumbar radiculopathy, we'll want to palpate the glute medius and glute minimus to see if we can get that familiar symptom that seems to travel down the leg. So first we'll want to identify the iliac crest and then the greater trochanter, and recalling that we have our glute medius fibers that run along this way and then our glute minimus fibers that run along this way. When we palpate, we're going to want to move in a perpendicular fashion to see if we can't find any kind of taut bands or trigger points. So if we start slightly more posterior, applying a pressure and moving back and forth, looking to see if we find not only just a tender spot, but specifically a tender spot that refers down the leg, that will indicate that possibly their referral pattern is from a gluteal trigger point versus a lumbar root that is irritated or dural tension. Same idea for glute minimus. We will go slightly more lateral, deep, and then strum back and forth, up and down the length of the muscle to see if that reproduces any of their familiar symptoms. And sometimes you do need to find that tender spot and then sustain a pressure to see if it then refers down the leg. If that's been referred, that's when you can use whatever tool or treatment technique you feel more comfortable with. It could be soft tissue, it could be instrument-assisted techniques, it could be dry needling, cupping. I think anything that you feel comfortable with could potentially reduce this symptom.